Good morning, ladies and gentlemen. My name is Diane, and I'll be your convener for this track, which is track 3, promoting the adoption of technology innovation in healthcare. We thank you for joining us today. We will kickstart this track with a panel discussion titled Maximizing the Impact of Healthcare Technology Innovations. The session will be moderated by Dr. David Walcott virtually. David is committed to bringing world-class healthcare to emerging markets as founder of Novamed, a healthcare investment firm focused on healthcare services, medical education, and health innovation, with portfolio companies in Latin America and the Caribbean, MENA, and Africa. His founding partners of the Visionary Summit, an opportunity exchange platform convening a committee controlling US 140 billion in equity that has seeded over US 300 million in investments in the Caribbean. He has been recognized by the Forbes, World Economic Forum, the United Nations, and the IMF, and is currently a member of the WEF Global Future Council and Young Global Leader Communities. His academic profile includes the Rhodes Scholarship, Oxford, INSEAD, Harvard, and Wharton. Please welcome David to begin their panel discussion. David, please.
Perfect. Thank you so much for that excessively generous introduction. Today we're going to kick off our session on maximizing the impact of health technology innovations, which is absolutely critical in today's world, where the world has shifted pre and post pandemic, and we have many things to be grateful for, but also a far way to go. Now, post COVID-19, funding towards healthcare innovation has significantly blossomed. However, we still face persistent challenges in attaining what we should define as impact. In many cases, technology has failed to reach the last mile. Many legacy systems have not quite adopted technology, and persistent challenges are still to be found in financing, adoption, workforce, and infrastructure. And so today we've invited 5 stellar panelists, each sharing different perspectives to offer words and thoughts on how we can effectively maximize the impact from healthcare innovation in the days to come. We'll have words from industry, policy, and public health. Michael Wong from Daveling, Stephanie Allen from Deloitte, Von Leong from Purpose Venture Capital, Amelia Litania sharing policy words from the Economic Research Institute for ASEAN and East Asia, as well as Kamran Khan from BlueDot. Now, just to kick it off, I'd love for each of the panelists to share very brief words about who they are and what they do. Let's start with you, Michael.
Thank you, David. My name is Michael Wong. I'm the chairman and CEO of Health Compass. It's a US-based Washington, D.C., as that's where I currently live, professional service firm. What we do is we bring the best of healthcare AI from the world into the United States in a secure and appropriate manner. We've been out this about a year, and we're scheduled to be launching early next year, and I'm excited and honored to be a part of this panel. Thank you.
Thanks, Michael. We'd love to hear from you, Stephanie.
Thank you. So Stephanie Allen, I lead the Deloitte Global Healthcare Practice. I live with my family in Australia and do work extensively across the ASEAN region. We're delighted to join you today.
Thanks, Stephanie. Kamran, let's hear from you.
Well, good evening, everyone from Toronto in Canada. My name is Kamran Khan. I wear a few different hats. I'm a practicing infectious disease physician. I've been in practice for over 20 years. I'm a professor of medicine and public health at the University of Toronto. I'm studying outbreaks and epidemics for my entire career. And I'm the founder and CEO of a global epidemic intelligence company called BlueDot. We primarily operate, I would say, in the public health and private sector, those markets, a little less so in the healthcare sector per se, but really excited to be here with everyone today.
Perfect. Thanks, Kamran. And of course, to our esteemed in-person participants, Amelia, we'd love to hear from you.
Hello, good morning, everyone. My name is Amelia Litania. I'm from AREA, organization focused on developing economic integrations in ASEAN and East Asia. And we are branching out to emerging issues and technology innovation as well. And I'm very excited to kick off today's conference. We are all in.
Thanks, Amelia. We'd love to hear from you, Von.
Thanks, David. Good morning, everybody. This is Leong. I'm from Singapore, early stage global venture capital firm that invests focus in Southeast Asia. We look at a sustainable and impactful tech startups. We have about 26 investments in our portfolio come from Purpose Venture Capital. On the side note, I wear different hats as well. I'm also a global senior executive coach at Amazon Web Services, as well as the co-founder for a COVID-19 response, Masks for All Singapore.
Perfect. Thank you so much, Vaughn. Now, in true healthcare fashion, let's take the pulse on where healthcare innovation is at this point. And there's no better person to sort of kick off this discussion than Stephanie, who leads the healthcare division of Deloitte, and of course has a very broad perspective on the current state of healthcare innovation post COVID-19. So, Stephanie, we'd love to hear your thoughts on what the current state of the market looks like within healthcare from an innovation perspective.
Yes, thank you, David. So just, I guess, setting the scene here. So like many sectors, healthcare's obviously been undergoing some rapid transformation. So we're seeing advances in data and interoperability, advances in technology, new consumer needs, shifting demographics around the populations we're serving, and of course the sustainability agenda. And that has meant that the world is really turning to digital solutions and remote care now more than ever before. And so some of the innovation that we're seeing in healthcare is wearables and digital diagnostics and digital therapies and remote monitoring and telemedicine. But there's just 3 data points that I'd really like to share with you to set this discussion alive. So the first is there is a huge increase in the value of digital care across this region. So in 2020, it was $37 billion, and that's looking to rise to $100 billion by 2025. So a huge snowball in investment. The second area I would say is that, Asia seems to be really keen on digital technology. So again, a lot of the survey data shows that, 78-80% of people are willing to use digital technology, and that's about 65% across the global markets. So it's definitely a region that is ripe for acceptance and ripe for innovation. And the last point that I would come to is that across this region, we also have some of the lowest density of skilled health workforce. So on average, we have 1.5 skilled health workforce per 1,000 population, compared to the OECD average of 3.4. So what that means, I think, is a fantastic context in which we're seeing significant investment in technology, significant appetite for technology, and also significant need, particularly around workforce shortage, to put technologies in place to really continue to deliver high quality healthcare.
Thanks so much, Stephanie. And you made a very important point in that there has been a snowball in capital allocation towards healthcare. And of course, the ASEAN region seems to be to have quite an appetite for healthcare innovation. I'm going to pivot to you now, Vaughn, as someone who is involved in capital allocation towards healthcare in the ASEAN region. What sort of innovations are you seeing, and what lies on the horizon for healthcare innovation specific to the ASEAN region?
Okay. Firstly, I just want to clarify that I'm not going to speak for all my VC friends in the business. I do invest globally. Most of my health tech, biotech portfolio is actually global companies. But having said that, we are on the lookout for health tech innovations as impactful and sustainable tech investment theses. I think the focus right now in terms of opportunities is going beyond what we call telemedicine, virtual care, and all of that. Because in ASEAN, the truth is we do have the hard infrastructure, 5G being rolled out quite successfully for most of the countries. Although the band spectrum and the bandwidth is still not at the level, but we do have a hard infrastructure to do more digital technologies. So the kind of areas that we're focusing on is really on software and services in terms of building on that momentum of that 5G rollout. The other things that we do look at is in terms of opportunity is how do you expand from physical care to more of a whole of person care. So we look at more like social determinants of health. We look at mental, emotional, environmental, and we also look at what climate change will affect, human diseases, human health, community health in general. So I'm interested as an investor. I'm also looking at what is that holistic approach and what will be that platform to create things from regenerative medicine to new sort of digital therapeutics. That will apply that holistic approach, which is whole person health. Because I think that should be the game changer or the move the needle in terms of supporting a person, and if we move more towards the patient empowerment, patient-centric model to extend those care. In terms of deal flow and market size, last year in ASEAN, we did have a lion's share at health tech segment of ASEAN, about 5.4 billion, and it has a year-on-year growth momentum. This year, although there's a reduction of 40% of venture capital allocations for health tech, for whole of ASEAN, health tech is still quite healthy in terms of because most of the investors, especially I'm from multi-family office, we look at we're more patient capitalists, so we look at longer term opportunities. We also look at it as a recessionary hedge. So there will still continue to be investments in bio and health tech, but we are very worried about valuations, because valuations at health tech is still quite high. There's no major correction yet, but the deal size and the number of transactions hopefully will still continue the momentum in Q3 this year. I don't have the numbers yet.
Absolutely, and thanks for that, Vaughn. Chiming in from your perspective, Mike, as a capital allocator in the US, which historically has allocated the most capital towards health technology globally. What are your thoughts on where the sort of landscape is shifting towards post-COVID-19?
Well, thank you for that, David. So to echo what Stephanie and Vaughn said, so in the US, as we all know, healthcare is quite a big opportunity. It's a big challenge. The landscape is mature with a lot of incumbents. And so what we're looking for when we actually do those investments, you can see lots of innovation and lots of different bets being placed. We're getting to the point where we're looking for the return on some of this. And Vaughn, you mentioned digital therapeutics. We agree with you. We think that is actually something that's very exciting. There's a lot of players in the marketplace and everyone's trying to find their niche. And we are excited through Health Compass to be able to be playing in that space. One of the reasons why we're really excited about participating in today's conference is because we believe some of the industry leaders in the world are in ASEAN, right? And we're actually excited to be starting to partner with some of them and bringing those innovations to the US market in an appropriate way.
So thanks for that, Michael. And the ASEAN region has always sort of stood out as holding its own in the context of global innovation. There's a reason why Uber is not Uber in the ASEAN region, but rather is Grab. And sort of the market dynamics are very interesting, and I think lend themselves very much to opportunity in healthcare on a local regional scale. Chiming in from you, Kamran, as an entrepreneur, as a physician who specializes in, I suppose, data intelligence, what sort of challenges and opportunities are you seeing on your side?
Mm-hmm. Yeah, thanks, David, for that question. I guess maybe just speaking to how COVID has really just, in a short period of time, just changed really our perception about epidemics and infectious disease threats. I mean, the whole planet was really, has been impacted for multiple years. So what I see from my end as an entrepreneur in the digital public health domain is there is clearly a global demand, not only from the public sector, but the private sector, to be able to identify threats around the world as early as possible. There's lots of opportunities to be using things like machine learning and natural language understanding models to do that. Secondarily, to be able to quickly understand those threats, because they're appearing around the world on a day-to-day basis, and they don't all turn into pandemics. So rapidly assessing which ones demand our attention, what's their likely trajectory and evolution. And then finally, how do we integrate that intelligence into the decision-making processes of a pretty heterogeneous set of audiences, from public health agencies to healthcare systems. I mean, as we saw during COVID, this is an event that has impacted the whole of society, not just the healthcare sector. So I think there's certainly ongoing challenges. I would say there has been progress certainly during the COVID-19 pandemic, but there still is a long way to go. I will say, in my experience, I still see a lot of things being done through fax machines and in databases that are disconnected, at least in the public health sector. So we've come some way, but we still have a long way to go.
Thanks, Kamran. And I do appreciate your message that the public sector needs to be able to identify, respond, and intelligently make decisions in response to health data and sort of changes in the landscape. And so I'll pivot that insight to you, Amelia, as someone who is involved in healthcare on the policy level. What is your response to the need for the public sector to really be able to participate to a greater extent in the shifting healthcare innovation landscape?
Okay, I'll just start by giving an ASEAN perspective. ASEAN has put forward master plan for connectivity in 2025, right? And it estimates the digital disruption in healthcare will potentially be able to bring economic growth up to $50 billion in 2030. So there's a huge opportunity here. And I think that we translate into healthcare policy and technology within that area as well. I do believe that because of this conflict, we're seeing more and more strategic partnership between public and private sectors. Beforehand, it was there, but it accelerated even more with COVID-19. For example, in Indonesia, they're partnering, the Ministry of Health, partnering up with the Halodoc, the applications to provide telemedicine and e-pharmacy digital platform, and also partnering up with project for grant, the health rating applications. And then we're seeing these new non-traditional entrants, such as conglomerates, philanthropy as one, and also telecommunication company emerge and partnering up with traditional incumbents such as insurance, also government actors as well. So I think there's a huge opportunity there in which moving forward there will be more collaborations, more working together with all stakeholders. But I also want to highlight the challenges, the main challenges that I think ASEAN countries mainly face is the regulations, regulation in terms of data protections and data management is still one of the key issues. For example, in Indonesia, I'm saying Indonesia because our office is in Indonesia. We just enacted its first personal data protection act this September, and it's not yet law. So you can see how long it takes domestically to process, and even the further implementation down the road for that. And I think it's also quite similar cases in Malaysia, because we're still having this problem with data protection and also sharing cross-border data and data management. So I think moving forward, that should be also the focus of the policymakers across ASEAN countries. And I think, that will help the digital health infrastructures be able to put a good basis for the nation.
Thanks so much, Amelia. And it's clear that policy has a significant role to play in driving maturation of the healthcare ecosystem. I'd just like to double click on you as we shift away from sort of understanding the barriers in the landscape to the solutions. What sort of policy frameworks would you put on the table to support innovation policies that drive innovation. Are there any sort of recommendations around IP legislation, federal budgets, etc., that can be baked into the public sector's voice on healthcare innovation?
Yeah, so I think again, it should be centralized. I mean, the government obviously should make a centralized, for example, like I said, the issues for data privacy, it should be the backbone should be out from the government, and then it should be streamlined to all the actors or players across the health tech innovation. For example, into 2021, we established the Digital Transformation Office. And also,
Is there another account that we can here other than
to establish the similar office, which is actually really great and something that can streamline all the effort from the government to all the players in the domestic region. So, in my knowledge, that the Digital Transformation Office also work with not only the private sector but also academia. Also making sure the incubator process taking place to start, which health technology, which potential health tech startups that would be big in the future, as one state not
would it log
only
out if I
focusing on,
continue for him?
the current
Yes.
telemedicine,
Never
but
mind.
also e-pharmacy, but moving forward more therapeutic and also more rehabilitation process, for example, the use of neurotechnology for stroke patients. And so these are the type of new innovations that correlate efforts from the government, also to manage it to other players in the region, from university, research, academia, incubator, startups, and also other private sector.
Got it. And so it's clear that there is a need for this multi-stakeholder model. And of course, one of the heads of the snake of driving societal change is the private sector, and typically, in particular, capital allocators and professional services. I'd love to hear your perspective, Stephanie, triangulated against what Amelia just shared in the need for this sort of multi-stakeholder model. What is the role of the private sector in maximizing the impact of healthcare innovation?
Yes, I mean, I think that the private sector has multiple roles to play. If I'm really honest with you, I think when I think about how we set up for success, it's about building connected ecosystems, and they might be connected digital ecosystems, but you will have a funder, a technology partner, a provider, a payer, consumer groups. The voice of the consumer would also need to be in there. And so when I think about how we're trying to construct some of the most important initiatives that we're driving, so things like virtual care at scale that Yvonne spoke about, things like healthcare sustainability that looks at carbon footprint and social equity. It is really in a combination of public and private partnerships that come together in an ecosystem to take that agenda forward. And that does include, as you say, investment, but it also includes skills that the private sector or technologies that the private sector need to bring to knit this ecosystem together. So there's one skill that I would say we need to get better at in healthcare, and that is the technicality of bringing that ecosystem together in a way that everybody feels comfortable and everybody moves forward with momentum to deliver those health outcomes.
Thanks, Stephanie. And it's sort of a chicken versus egg situation where ecosystems mature, which drives greater capital allocation, and greater capital allocation drives greater ecosystem maturation. As a capital allocator, Michael, how do you see the sort of shifts and increases in capital allocation in healthcare serving to maximize the impact?
I appreciate that question. So, I'm in Washington, D.C., and just going back on another point of the conversation with Dr. Khan mentioned, like he specifically said, hey, that we need to have more access to data and we need to be data driven. I think getting access to that is really important as we look at policy. But on the private side, it's really about data driven decisions, and getting access to that is just going to take some time. right? And we just have to be somewhat patient. And I think from an investment perspective, we have to have that longer horizon. I mentioned before, we're really long on digital therapeutics. One of the things that the private sector is looking for is data, right? We would be able to deploy digital therapeutics at broad scale if we had access to more data, specific clinical data. You can actually prove those outcomes, you're going to have broad adoption. That's what we're working on. And so, as you can imagine, in terms of the public health, and you think about the research cross-border, I think that's something we're really excited about, but it's just going to take some time.
Got you. Thanks, Mike. I would love to hear your perspective, Vaughn, as a local capital allocator. Are you seeing the same sort of need for greater levels of data-driven decision-making as we seek to navigate the changing innovation landscape?
As an investor, I'm always interested in getting access to more data because more data equals more better health outcomes. But I think my point here, I'm far more interested to state something in terms of what I'm more action-oriented. So I'm focusing on a couple of things here. I think we should, now we have a forum here, there's a convening of minds. What that means is that there should be a impetus for both policymakers, private capital, and the other stakeholders to come in and collaborate. So a couple of things that can move forward is what I call game changers. So number one, you need to have real investment into both the infrastructure, the hard infrastructure and soft infrastructure. So hard infrastructure would be your 5Gs, your physical facilities. The soft infrastructure will be your human capital. And all the others that's related to encouraging, spurring investment in that. In Singapore, we do very well in spending about 80 billion over a period 30 years in the R&D facilities and infrastructure. And that really spurs that sort of human capital. But even then, we're still doing a catch-up because there's staffing shortage around the world. It's too hard for us to bring up psychotherapists or physicians overnight. So you need to go into technologies. But in order to get technologies, you need to have some innovation, incubation infrastructure. And that requires funding as well as ideas. So in order to create funding, you need to have some game changer. So in Singapore, we tried VCC structure, which is a structure by the government to encourage more setup of private holdings, investment holdings by families. So we now have 700 to 800 single family offices in Singapore alone, and that spur local and regional investment, and that create that impetus, for VC and drives VCPE activity. And finally, that sort of tax incentives that encourage the private capital to come in, and then with different ASEAN and government policies directing where should the investment go to by creating other sort of risk-free capital, like philanthropy, like the Masik Foundation, like the Brunei government coming in to do prototyping, doing seed funding. Indonesian government has the same, Vietnam government has the same. So you need that whole ecosystem approach to line it up so that private capital will find it easier willing to take some risk, because we all know medical devices, biotech, certain health tech technology will take too long to commercialize. So we like to come in where we do best, commercializing it, monetizing it, scaling it up. So with now convening of minds, I would also suggest that ASEAN should come in to create a supplier forum where data would be exchanged, where Amelia talked about some framework to exchange data. Currently, there are technologies like privacy enhancing technology that you can share data, but it can be anonymous. Certain data can be blocked and still shared safely, privately, and with cybersecurity infrastructure as well. So there is assisting data technology. We now have people coming together and want to influence each other. Now is the time to act, and the way to do that is to encourage both policymakers and private capital to collaborate in order to blend the best finance and infrastructure to spear innovation forward. Thank you.
Thanks, Vaughn. And just to hear from you, Kamran, as someone who effectively specializes in data, Notably, one of your many claims to fame is having actually predicted the COVID-19 pandemic ahead of the WHO. Where do you see data sort of lying in this entire value chain of, development of the ecosystem?
Let me just clarify, we had alerted our platform, again, speaking about data, had actually picked up some early, signals that there was a syndrome circulating in Hubei province in late December 2019. And we alerted all of our clients and actually published the world's first peer-reviewed study on COVID. So that was our, getting out of the gates quickly when we identified an emergency. But of course, I think, just echoing the other speakers' comments here, data is really central to how we can be making decisions, in many cases, dispassionately and objectively. I am mindful of time. I would like to maybe just perhaps make one other important comment. And as this is as someone who has seen epidemic threats and emergencies where there has been a significant reaction, including investment in capital to develop innovations, but those have dried up often shortly after the crisis has gone away. The problems that many of us are trying to tackle are long-term. They're complicated challenges, and they're going to require sustained investment over the longer term. So I do want to echo this right at the moment where we are hopefully transitioning away from the worst of the COVID-19 pandemic. The problems and the challenges that we're facing, at least in the space of infectious diseases, are not going away anytime soon. Again, I think I really just want to echo the importance of sustained investments in innovation over the longer term.
Thanks so much, Kamran. And as we seek to wrap up, this riveting discussion, I'd love to invite all the panelists to share one final message to our audience on how we can maximize the impact of healthcare innovation in the days to come. From my standpoint, sort of listening to the different perspectives shared between public health, industry, policy, etc., three things stand out to me, 3Ds, so to speak. Development, a greater level of long-term perspective as it relates to ecosystem maturation that involves the financing, that involves workforce development, that involves policy and community. 2, greater levels of data-driven decision-making, etc. And 3, dialogue, greater levels of collaboration, inter-industry, industry, academia, and public-private sort of partnerships. So these are the 3 things that sort of stand out in this discussion: development and dialogue. I'd love to hear a final message from each panelist, starting with you, Michael. What is your final message that you'll leave to our distinguished audience?
I believe the future is bright. I think it will be driven by data, but I think we need to be patient.
Thanks, Michael. Stephanie, what is your parting message?
My parting message would be the how that we do this is going to be as important as the what. And when I think about environmental sustainability and social and equity issues, particularly in this region, I think we need to be mindful of how and the impact that that's going to have on the environment and on our communities, as well as the what we're going to do.
Thanks, Stephanie. Amelia?
Thanks, David. And I think I like this sentence called hospital without notes. So I think moving forward, it's already happening right now, but moving forward is going to become more important. We keep that in mind. So we know that all stakeholders need to work together, especially the policymakers, to really make the regulation effectively the backbone of all innovations that have taken place across the region.
Okay.
Thanks, Amelia. Kamran, what is your sort of parting message?
I'll leave the message that the COVID-19 pandemic has really highlighted just how interdependent we are in terms of our health across the world. And so I think I just want to echo some of Stephanie's comments earlier about innovation is not just for those who have the most financial resources. I think we do need to think about how we can make these innovations accessible to everyone. Ultimately, our health and our well-being is intertwined in our hyper-connected world. So I think that's my final comment for this evening.
Thanks, Kamran. And finally, last but not least, Vaughn, let's hear your final words.
Act now, don't delay. It requires political will and leadership. So if you really believe in impact, go ahead and make your impact. And the first thing you need to do is encourage your policymakers to incentivize, influence different stakeholders to come together to create impact for the society and for our people. Thank you.
Perfect. Thank you, Vaughn. No, unfortunately, given time restrictions, we do have to close this session. But I do hope this serves as a starting point for further dialogue and beyond dialogue, further action to be driven on how we can maximize the impact of healthcare innovation. As Michael said, the future is indeed bright. Thank you so much for your attention. And let's move forward with a renewed sense of community and optimism for how we can best maximize impact in healthcare moving forward. Thank you very much.
Thank you, David and the panelists for the informative and fruitful discussion. On behalf of the organizer, we would like to present a token of appreciation to on-site panelists. So can I have you? Thank you everyone for joining us today. With that, we will wrap up this panel. The next panel will start in 5 minutes. See you. Thank you.